Abdullah for the wonderful introduction. And I hope I do justice to this topic today. So, yes, I'm Dr. Richa Kapoor Meglani from Mumbai, India. And today we'll be discussing in short about how diode lasers have revolutionized the entire aspect of periodontal surgeries. So this is what I am doing besides clinical dentistry. I love to teach. Teaching is my passion. And we do a lot of hands-on programs on periodontology as well as laser dentistry across the globe. So when we talk about any kind of oral surgical procedure, be it a periodontal surgical procedure or an oral surgical procedure, the problem that most of our patients have, or the concern all the patients have, is about fear of blood and fear of sutures. So if we tell them that we are going to do a procedure, a surgical procedure without any bleeding or without the need of sutures, I'm sure they're going to be more excited about the procedure. So that is why it is very important to incorporate lasers in your practice, because lasers offer the following advantages. Look at this gingivectomy being performed on a lower premolar. It is, of course, a surgical procedure, but the patient is absolutely comfortable. There is no bleeding whatsoever, and excellent accessibility and visibility for the operator. So I'm sure by now you have understood that lasers have really redefined periodontal surgeries. They provide a bloodless field when you're performing a surgical procedure. There is a sterilization of the surgical site. That is, the surgical site does not have any kind of microbial contamination when you are using lasers at the particular site. So I think this is an excellent tool if you want to do it in patients who have uncontrolled diabetes, because there is going to be no contamination of the surgical site and it assures faster healing for the patient. Of course, there is no need to give any kind of sutures after you perform any procedure with the help of diode lasers. These two important advantages, that is a bloodless surgical field and no need to provide any sutures, give a very comfortable experience to your patient. The types of lasers available in dental practice are broadly two types. One is an all-in-one laser where you can do both hard and soft tissue procedures with the laser. These are the erbium group of lasers. And then there are the soft tissue diode lasers, which can be used only to perform surgical soft tissue procedures as well as bleaching and low-level laser therapy. Today, my entire lecture would be centered around the use of soft tissue diode lasers for periodontal surgical procedures. Now, diode lasers fall in the near infrared zone, and that is why the common wavelength that you will be coming across when you buy a dental diode laser is the 980 nanometer diode laser. The entire lecture today will be focused on use of these diode lasers in various periodontal surgeries. Before we go about understanding the applications of diode lasers in periodontal surgery, let us first understand what are the different parts of a diode laser. Whenever you buy a diode laser, be it any company, I don't want to name companies in my lecture though, any company that you buy a diode laser, it will have a LED screen, which is going to be the main part of the diode laser. Using this touchscreen display, you can change the settings on the diode laser and use it to your convenience. There is a foot control which is available with the diode lasers. These can be wired or wireless foot control. They are connected to the main machine with the help of a Bluetooth setting. There is a foot switch cable in some companies when you want to attach the foot control directly to the laser machine. There is an AC power adapter. And the most important part of any diode laser machine is the multi-unit handpiece, as you can see in the picture. On this handpiece, you will attach various tips which can be used to carry out the different surgical procedure. If you do not want to perform a surgical procedure and want to carry out bleaching, you will attach a bleaching handpiece. Alternatively, you have flat top handpiece, which is used for low-level laser therapy and photobiomodulation. Now, the tips that are available with the diode lasers are in three types. 200 microns, 300 microns, and 400 microns. These are disposable pre-sterilized tips that will be available to you along with the laser device. Some lasers give you the option of using an entire fiber spool where you do not need to use single disposable tips every now and then. Rather, you will be cutting the tip of the fiber after you finish every patient. The choice is yours whether you want to use disposable tips or the single spool fiber. Then coming to safety glasses. These are class 4 diode lasers, and it is important to maintain safety when you are using these diode lasers in your clinical practice. So it's extremely important that the operator, that is the operating dentist, the dental assistant, as well as the patient has safety glasses on during the entire laser procedure. Then you get a metallic case in which you can carry the laser from one clinic to the other or from one operatory to the other. This is the biggest advantage of a diode laser, which is not available with the erbium group of lasers. You can carry the diode lasers between two practices easily because they are small and they are compact. Now let's understand or see how a frenectomy is being performed with the help of the diode laser. Now, as we see this video, there is a laser handpiece or a laser tip which is being used to perform the frenectomy. If you visualize carefully, the tip is completely touching the frenum, the soft tissue. When you use the diode laser handpiece in this fashion, that is, the tip comes in contact with the soft tissues, it is known as a contact mode. Again, I repeat, the diode laser handpiece, the tip comes in direct contact with the soft tissue. So this is known as a contact mode. In this case, you see again a tip which is being placed near the surgical tissues, near the oral tissues, but not completely in contact with the tissues. So this is known as a non-contact mode. When you wish to perform a surgical procedure like frenectomy, depigmentation, crown lengthening, you will be using the laser in a contact mode. When you want to use the laser for its photobiomodulatory effects, that is the low-level laser therapy, you will be using a non-contact mode. That is, the laser tip will not touch the tissues, but it will be slightly away from the tissues. This is seen in the case of oral ulcers, herpes simplex ulcers, TMJ disorders, and other such low-level laser therapies. Now, today our lecture is centered more around surgical procedures. So let's see how you can use diode lasers in orthodontics. Gingivectomy sometimes required after an orthodontic treatment is complete positioning. Lasers are an excellent device when it comes to doing these kind of gingivectomies because the tissue is quite inflamed. The gingival tissue is pretty inflamed when you have to do a gingivectomy procedure. So in such cases, the lasers reduce the bleeding at the surgical site and improve your accessibility and visibility of the surgical field. Aesthetic laser gingival contouring is very similar to gingivectomy that we have discussed earlier. Sometimes there may be impacted teeth which need to be exposed to place an attachment on them. Lasers are an excellent tool. You do not need to call the patient for a second visit to specifically place the attachment on the tooth because lasers help to expose the tooth without any bleeding. Frenectomy and frenotomy both can be performed to uncover temporary anchorage devices like mini implants, healing of minor ulcers that occurs during orthodontic treatment. So let's see a video where we have removed the tissue that is covering the impacted canine with the help of a diode laser. In this case, I have used a Pion 980 nanometer diode laser. The tip size that I have used is 400 microns, which is a disposable tip. I'm using the tip in complete contact with the soft tissues. And as you can see in the video, it is a soft brushing stroke. So I cannot go too fast, otherwise I will not deliver the laser energy to the tissues. At the same time, if I keep the laser tip at one point for a very long time, it will deliver too much of heat and the tissue will get charred or burned. So with soft brushing strokes around the periphery, I'm removing the entire tissue so I can visualize where the tooth is completely. And once I can visualize the tooth completely, I will remove more tissue till my orthodontist is happy to see the canine over there. Now, as you could see in the video, the uncovering procedure was very clean and there was no blood whatsoever. So we do not need to call the patient once again to place the attachment on the tooth. It can be completed in the same sitting. Now, coming to another interesting surgical procedure called frenectomy. Sometimes patients who have diastema require frenectomy to remove the thick frenal band that is present between the two central incisors. And sometimes the frenal band is so thick that it is even penetrating into the palatal tissue. And in these cases, lasers are an excellent tool, because if I would to do the same procedure with the scalpel, I would be placing a couple of sutures in the buccal mucosa. Whereas if I have to do the same procedure with the laser, I will not be placing any kind of sutures. Now, a step-by-step procedure has been shown on this slide. Let's go around and understand how I have done this frenectomy. I have first given some infiltration anesthesia to the patient, after which I will be holding the frenum in the center with the help of a needle holder or an artery forceps. This helps to make the tissue tight or taut so that I can easily excise the frenum with the help of the laser. Then I choose the frenectomy program on my diode laser. Now, frenectomy, frenotomy, all these procedures are pre-fed into your laser device. You do not need to do anything. You just need to select on your device which procedure you wish to perform. The power settings are preset by your manufacturer. Now, once the tissue has been made tight or taut by you, you will take your diode laser and start excising this frenum from the base of the frenum. Once you have finished it from the base, you will start it from the upper portion. Again, it is very clearly seen in the picture that we are excising the frenum from the upper area. Once you have completely excised the frenum, the tissue is out, then you are not supposed to stop over there. Another important step is you place the laser device back, take your artery forceps or your needle holder and see the picture. I'm opening and closing the I'm opening and closing the artery forceps inside the frenal area. This is basically done to remove all the muscle fibers or attachments. This step is very important when you do frenectomy, either by lasers or by scalpel. Otherwise, normally there is a reattachment of the frenum again. A common problem that we see. So this is how we are doing a blunt dissection. We are opening and closing the frenum at the site where the entire attachment was removed. Now, if you see the site, there was no bleeding whatsoever, and the area can be well visualized by you. At the same time, because there is immediate collapse of the microvasculature, I do not need to place any kind of sutures, and the patient is good to go after the procedure. This is how the wound looks at the end of the procedure. I have removed the labial frenum completely. The area is very clean. There is no need to give any sutures whatsoever, and the patient is extremely comfortable after the procedure. The only post-op instruction that I emphasize is application of some vitamin E gel over the site for a week or so to keep the area clean. You do not need to prescribe any antibiotics after the procedure. Analgesics depends on the patient's pain threshold and can be given SOS to the patient. Now, talking about diode lasers in depigmentation. Very often you come across people who have these thick pigmentation of melanin in their gingiva, and it is more commonly seen in patients who are having a dark skin. So these patients sometimes are not happy with the pigmentation and they want to get rid of this pigmentation. Depigmentation as a procedure can be done by scalpel with the help of burr, electrocautery and lasers. Now, lasers are an excellent tool to do this kind of a procedure because you can actually evaluate the depth while doing a deepithelization. So whenever you do a depigmentation with any machine or with the scalpel, the entire idea is to remove the surface epithelium. Now, in case of lasers, when you try to remove the surface epithelium, because the site is so clean, there is no bleeding, you can actually visualize what you are doing while doing the procedure. Whereas if you do the same procedure with the scalpel, there's a lot of bleeding. So the ease of doing the procedure is slightly better in case of lasers than with doing it with a scalpel. The results, the end results are going to be the same and depends on the operator more than the tool that he is using to do the depigmentation. Now, another question is about recurrence. A lot of people ask me, is that the lasers that have less recurrence than scalpel? No. The recurrence rate would be the same, be it with the scalpel procedure, electrocautery, or lasers. The recurrence is because melanin is produced by melanocytes, which are a type of epithelial keratinocytes and are going to be formed continuously in the patient's mouth. So it is very important to do a good case selection when you want to do depigmentation. Select patients who have a thick gingival biotype and who have a band of pigmentation and not patches of pigmentation. When they have a thick band, like in the cases I am showing you here, and you remove the pigment, when there is a recurrence, the recurrence will be in small patches here and there, which looks more physiological rather than being unaesthetic. Again, in this case, the laser will be used in a contact mode. And here I have used a 400 micron strip. I'm very comfortable using a 300 or 400 micron strip when I want to work with the oral soft tissues, especially for surgical procedures. When you want to use the diode lasers for endodontic procedures, you can use a 200 micron strip. Now, in depigmentation, another important thing is that when you are doing depigmentation, always select a case where the gingival tissues can be manipulated easily by you. That is, patients who have a thicker biotype. In thinner biotype, it is slightly difficult to do it, not that it is impossible. So one case I have shown you which has an extremely thick biotype and one case has a slightly thin biotype. So in both the cases, we have done depigmentation. And one important aspect is whether you do it with any procedure, depigmentation always leave 0.5 millimeter of marginal gingiva intact. Why? Because if you try to remove the pigments in the marginal gingiva and you're not too experienced doing this kind of a procedure, there is a risk that you may hamper or you may damage the marginal gingiva. And this can cause iatrogenic damage, that is, there can be some kind of recession that can happen if you do not leave that 4 mm or 0.5 mm of marginal gingiva intact. Now, coming to another very interesting case where we have used the diode laser for doing gingivectomy and gingivoplasty. Now, in this patient, orthodontic treatment was done to close the gaps. There was an implant that was placed in the edentulous area. And as we were about to finish the treatment, there was a need to do some type of gingivectomy in the anterior region and also remove the frenal band. There was a gingival overgrowth that had happened between the two central incisors. So in this case, I have used a 980 nanometer diode laser, again in the contact mode. And I have done two things. One, remove the frenum and at the same time done the contouring of the gingiva so that the right and left side gingival symmetry and zenith can be matched. Now, a lot of procedures could be done in one visit because of the ease of which the diode lasers provide you to do a procedure. Now, you need to understand one thing, that when you start using a diode laser for a surgical procedure, there is a very important step that you need to do. That step is known as fiber initiation. You need to initiate the tip of the laser fiber before you start the surgical procedure in order to concentrate the entire laser energy at the tip of the fiber. If you do not do this step, you will not be able to cut or excise the tissues properly. Now, this step can be done with the help of an articulating paper or a cork paper. Some laser devices will be providing you with a cork paper to initiate the tip. And if they do not provide you, you can use the articulating paper, the blue articulating paper, to initiate the tip. Keep the laser at a very low power setting of 0.5 to 1 watt. Touch the tip around 8 times to your articulating paper. So what you are doing is you are making the laser interact with the articulating paper, which is a chromophore. This helps to bring about some kind of a laser and chromophore interaction and concentrates the energy at the tip of the laser fiber. So now your tip is going to become red hot, and now it is going to be ready to do the surgical procedure. When we actually perform this hands-on in front of you, you will get a better idea about how to initiate the laser tip. Now coming to crown lengthening or gummy smile correction. A lot of patients come to you and tell you that they are not happy with their smile because their gums are very visible when they smile, or their teeth look too small when they are smiling. So these are classically cases who have a gummy smile. That is, a lot of the gingiva is displayed when they smile. There can be three common reasons for having a gummy smile. One is a vertical maxillary excess. The other is an altered passive eruption. And the third is a short upper lip. Now, out of these three, the most common indication of using a surgical procedure to correct the gummy smile is when you have an altered passive eruption. In that case, the gingiva keeps remaining attached to the tooth enamel and has not gone apically and attached to the CEJ of the tooth. So in these patients, whenever they smile, the teeth look square and squat shaped, and a lot of gingival exposure is present. Now, this lady who presented to us had two issues. One, of course, was the gummy smile. The other, which I noticed, was that the gingival tissue was extremely inflamed. It was thick and edematous, and there was a bulbous labial frenum that was coming in the way between the two central incisors. So, of course, she could not have an aesthetic smile because of also the frenum, which was like a bulb between the two central incisors. So here I plan to do a frenectomy for her and a gingivectomy along with a gingivoplasty. So in this case, I was able to get rid of the inflammation. I was able to get rid of the thick frenal band and also give a good maintainable architecture of the gingiva to the patient for long-term maintenance of plaque. Now, another case where the girl had come to get veneers done from canine to canine, and of course, the restorative treatment was done later, and she also had a complaint of gummy smile. So, in this case, before doing the restorative phase, with the help of the diode laser, we have contoured from canine to canine the gingiva. Now, when you are doing this contouring, you need to give great emphasis to gingival symmetry as well as the gingival zenith. The central incisor and the canine gingival margin should be at the same level, whereas for the lateral incisor, the margin should be slightly more coronal compared to the gingival margin of the canine and the central incisors. This has to be equilateral or symmetrical on both sides, that is on the right and the left half, if you want to give the patient a very harmonious smile. Now, I understand doing this freehand may be a challenge for most of us. So what I do is I make an alginate impression of the patient, pour a model for the patient, and then prepare a stent on my model of the new gingival margin. When the patient walks in for the surgery, you make him wear a stent and carry out the entire surgical procedure. So you are rest assured that your gingival symmetry and zenith can be maintained well. Now, lasers are used very well when it comes to doing an excisional procedure, like a fibroma on the tongue. Similarly, on the gingiva also, you sometimes have gingival overgrowths. You have overgrowths when there is a drug-induced gingival enlargement. And there are many other procedures where you want to excise the lesion and send it for biopsy. So in case of this patient, there was a small irritational fibroma on the lateral border of his tongue. Now, if I was to excise this fibroma with the help of a scalpel, of course, it would not be very difficult because you just need to give local anesthesia and cut it off. But consider the post-operative care. One, you would have to place suture over there because there would be extreme bleeding because the tongue is a highly vascular organ. Other, the suture would be troublesome for the patient because it's on the lateral border of the tongue. So swallowing, eating, chewing will be a trouble for the patient. So in this case, we have first infiltrated the area, and then with the help of the diode laser, I have excised the tissue. Now, this was one of the early cases that I had done with diode laser, and it was exciting and cutting very beautifully. I was just adopting them into my practice. Today, there would be a slight change that I would be doing. When I earlier started doing it with the diode laser and it was excising and cutting very beautifully, I had a tendency to keep increasing the power or the watt on my laser device because it would cut faster. However, over a period of time and after reading a lot of articles and theory, I have realized that it's very important to follow a concept of MIMO, MIMO, when it comes to using diode laser. Now, what is MIMO? MIMO means minimum input, maximum output. Always try to keep your power settings between 1 to 2 watts when you want to do any kind of oral surgical procedure. Of course, if the tissue is very fibrotic, you may have to go up to 3 watts. But try to keep the power settings minimal. This is because minimal input will give you less charring at the site, and less charring means less collateral tissue damage. That means you will not be spreading the heat energy to the deeper tissues, and there will be faster healing of the surgical site. So henceforth, I always keep this concept in mind when I want to do any laser surgical procedure. Also, I would here re-emphasize the need to initiate my tip before I am starting the surgical procedure. So I realized that for the last couple of minutes, I've been talking on and on about diode lasers and bombarding you with so much of information. So I thought, why not have this very interesting musical video where you are using a diode laser to uncover the implants. The implants were placed in the surgical phase, and when the patient came back for restoration, we have used a diode laser to uncover the implant so that we can carry out the prosthetic phase and place the healing cap comfortably. So once again, let's have a look at this video. So in this case, again, I've used a diode laser and in a contact mode. The first step is I will be using a little bit of infiltration anesthesia. Then I would locate where my implants are placed. Instead of blindly just removing the soft tissue, I have first located the implant position. After that, I have initiated my tip, keeping the power settings to 0.5 watts and using a blue articulating paper. And as you see, I'm scooping out the tissue which is present in the particular area where the implant is, using a short brushing stroke. And as you see carefully, when I'm doing the procedure, at the tip, there is a lot of debris or soft tissue that keeps getting attached as I cut through the tissue. Now, it is very important to keep wiping off your laser tip with the help of a gauze dipped in saline. Because if you do not do this, the laser heat or the energy will not directly reach the soft tissues. All of it will get absorbed by the debris that is present at the tip of the laser device. So this is another important tip. Whenever you are doing any surgical procedure with the help of a diode laser, a lot of coagulum, soft tissue, and debris will continuously keep getting formed at the tip of the laser. Take a gauze, dip it in saline, and gently wipe off the tip. Now, if you see all my videos, as I'm doing the procedure, I'm not continuously going on excising the tissue. I am giving some breaks in between. This is known as thermal relaxation. If you keep on doing the laser procedure continuously, you will be delivering so much of heat to the soft tissues, resulting in a lot of collateral thermal damage. That is, you'll cause a lot of heat damage to the underlying soft tissues, hard tissues, the bone, etc. So to avoid that, you have to keep giving some break to the patient while doing the procedure. This helps the tissues to come back to their actual temperature, and then you again start the procedure. Let's once again have a look at this video. So here we are trying to uncover around 2 or 3 implants with the help of the diode laser. This is the first implant that we are going to be uncovering. When you are uncovering the implants, you can go in a round and round fashion around the area, and I'm taking a lot of care to ensure that my diode does not touch any other segment except the soft tissue. The periods when the tip is not coming in contact and going away from the area is when I'm actually wiping it off with all the debris with the help of the piece of gauze. Now, lasers in teeth bleaching. Yes, this is another very interesting application of diode lasers. Now, when I talk about use of diode lasers in bleaching, I do not mean that I don't need to use the chemical bleaching agent. We all know that to bleach the teeth or to carry out teeth whitening, you need to use a chemical agent. Now, this chemical agent, of course, will be used, but the laser would be an adjunct to the chemical bleach. The biggest advantage of using a diode laser with the help of a chemical bleach is the post-operative sensitivity. We all know that when we are doing bleaching with the help of a chemical bleach, the patient is bound to have some amount of sensitivity at the end of the procedure. But I have seen that when you use a diode laser to do this procedure, the post-operative sensitivity is minimal or very less for the patient. The protocol of bleaching will remain the same. You will first do a scaling polishing for the patient and remove the plaque and calculus. Polishing is very important when you are placing the bleach. Then you will place the gingival barrier, apply a chemical bleach, and then use the laser handpiece, which is slightly different from your surgical handpiece, and carry out the bleaching procedure. Now, normally when you want to do bleaching with the help of lasers, the power, the watt is slightly higher. You need around 7 to 8 watts when you want to do bleaching with the help of diode lasers. So when you go to the market and you want to buy a diode laser, normally the question that you will be having is, which wavelength should I buy? One. And the other biggest question is, what is the maximum power output that my laser device should have? For this, you need to understand that if you want to use the diode laser for only doing a surgical procedure, like gingivectomy, frenectomy, or crown lengthening, you can buy a laser which gives you a maximum output of even 4 to 5 watts. However, if you wish to do bleaching with the help of the diode lasers, then you need to invest in a laser which gives you a more power output, around 7 to 8 watts. In the market, if you go, you get lasers 7 watt, 8 watt, 10 watt, and 4 watt. This is the commonly available lasers in the market. There are a lot of brands out there in the market. You need to assess which company laser is going to suit you for your dental practice. So when I talk about lasers in bleaching, I would like you all to keep in mind, it does not mean that you will just apply the laser light and not apply a chemical bleach. I repeat again, the lasers act as an adjunct to your chemical bleach. So towards the end of the session, there will be some important tips that I would like to give all of you before we close the session for today. This session was an introductory session to application of diode lasers. And of course, there is so much more that we would be doing in our future webinars, where we'll be talking about use of lasers in photobiomodulation, use of lasers in low-level laser therapy, and other applications of diode lasers. Before we end for today, there are 3 important tips that I want you to take home after the webinar. Tip 1, while a laser manufacturer would like you to believe that their photons are better than the others, it is not true. How they deliver this wavelength to the tissues is what is important, and how you are able to control this process to decide which laser to purchase. Yes, this is a very important question. Which laser should I go and buy? So when you go out in the market, there are going to be a lot of brands, all with varying price options. what you need to understand is what is the application of this diode laser in your dental practice, and what handpiece, etc., would you be requiring. If you are just going to use the diode laser for surgical procedures, you can constrain yourself to a lower power output diode laser, as I mentioned earlier. And most of the manufacturers out there would obviously tell you that my photons or my laser emits better photons of energy than the others. But all of you should remember one thing, that if there is a diode laser with 980 nanometer wavelength, it will be delivering the same photons irrespective of the brand. Tip 2, you need to master your correct hand speed while using lasers. There is only one thing that you as an operator need to learn when you are using a diode laser. Everything else is provided by the manufacturer. It is pre-fed into the device. It's that simple. You just need to click and start using. But you need to master the correct hand speed. If you go too slow, you will deliver a lot of heat at one place and you will cause charring of the tissue, the blackish appearance of the tissue. You do not want your tissue to be black at the end of the surgery. You want your tissue to have a slight suntan when it is done with. Not too fast. You cannot keep going too fast. Otherwise, the laser energy will not get delivered to the tissues. There will be no time for the laser to interact with the soft tissues, and you will get no result whatsoever. So this is the only thing that you will have to master when you are using the diode lasers. And most important, I would like to re-emphasize is that safety is of utmost importance, not only your safety, but your patients as well as your dental assistant safety. These are all class 4 diode lasers. So safety glasses which are provided by the manufacturer, I repeat, provided by the manufacturer should be used, because each safety glass will be providing you protection for that particular wavelength. If you go and use any other glass, it will not have protection for the diode wavelength that you are using, and you could cause damage to your eyesight or the other people in the operatory. So always wear the glasses provided by your manufacturer. If you see on the right hand corner of the glass, the wavelength for which this glass provides protection will always be mentioned. Have a look at that when you're going and buying these safety glasses. Mostly with the diode lasers, you will get 2 safety glasses and 1 blinder for the patient. Some brands offer 3 safety glasses, one for you, one for the patient, and one for your dental assistant. And as I end the session today, there is one quote that I love and I would like to get it to your notice also. Change begins at the end of your comfort zone. If you have been using a scalpel for your dental practice and you have now mastered them, it is time up that you move ahead and bring about a change for yourself and for your patients. Let's start providing a more comfortable experience to our patients, which gives them a better experience every time they come to your dental practice. This is my number, which can be contacted on WhatsApp. You can share some case details. If you want to discuss some cases for lasers or for perio, feel free to connect with me. I would again like to thank the entire team of BAGDENT for giving me this wonderful opportunity to interact with such a lovely audience. Thank you for the privilege of giving me your time and dedication for this session. Thank you.
Thank you so much, Doctor. It was very useful and very informative webinar. I would like to thank you so much for your effort for today's webinar. And of course, I hope that you can join us later in more deeper webinars speaking about laser and other topics of periodontics. I just received a question from Dr. Ahmed. He's saying, I think this question is related to using laser in excisional surgery, the case that you showed of the lesion in the tongue. He is asking, what medication is prescribed to the patient after treatment?
So as For any laser surgical procedure, I prescribe only anti-inflammatory and analgesics to the patient after the treatment. And that too, it depends on the patient's pain threshold, SOS. If the patient has pain, they can take the painkiller. Otherwise, there is no need to give any antibiotics to the patient after the procedure. There is a vitamin E gel, which is available commercially in the market by the name of Evion capsules in India. There may be another capsule by another brand name in your country, but it's a vitamin E capsule, which is ideally given for oral consumption. But in this case, what we do is we ask the patient to cut the entire capsule, remove the gel, and apply it on the laser wound.
Thank you, Doctor. I received another question from Dr. Noor. She is asking, do the different types of incisions like marginal or submarginal, external, internal apply in laser surgeries?
Uh, yes, this is a very good question. Now, when we are talking about doing a gingivectomy procedure, there is, of course, an external bevel and an internal bevel incision. You need to, yes, apply the same kind of bevel when you are doing a gingivectomy with the laser. And in that case, you will be activating the sides, or rather, I may say, initiating even the sides of the laser tip along with the actual tip. And then you will be giving a bevel, because if you don't do that, after the healing occurs, there will be a not so smooth transition between the gingival tissues and the tooth, and that barrier can cause a butt joint where the food and plaque may keep accumulating, because the end aim of any surgical procedure is to give the patient a very maintainable gingival architecture. So yes, you need to master using the bevel incisions even with the laser, in order to provide a more harmonious transition between the gingival tissue as well as the tooth.
Okay, Doctor, thank you so much. So for the end of our webinar today, I would like to notify that this lecture will be uploaded on YouTube, and the link will be provided for all of you, and it will be posted by our accounts of social media for BAGDENT, and it will be sent to Dr. Richa. Thank you for our participant in Zoom and our participant in our Facebook group. And of course, thank you so much, Dr. Richa. So now we are end for our webinar today.
Thank you so much. Good night.